Check. Hola a todos. Hello everybody. Here we are at McKenzie Fire and Rescue as a first responders, and we have today Clayton, one of the staff here at McKenzie. He's gonna talk to us a little bit about what do we have and how we're gonna use, and what are the protocols that we're following when we have a potential person infected with the coronavirus. Clayton?
Hello. So some of the things that we decided to put together when it comes to the coronavirus after research is that we have N95 masks. Here you see that there's N95 masks in here. They're different than their standard dust masks in that they filter a little bit more particles and stuff as far as the little infectious things. We also have these type of N95 masks, which we grab off of Eugene Springfield Fire to restock ours, as well as some other styles in there too. So we decided to take it a step further than that to revise our infectious disease protocol, because we're coming to find out that this virus, as with what the recommendations of the World Health Organization and CDC say, is spreading at a rapid rate. So what we did at McKenzie Fire and Rescue is we determined that we wanted to put together these little kits, kind of like this, for first response. It starts with our dispatch telling us that these people have symptoms that are flu-like. But then what we do is we screen them at the doorway, and if necessary and we need to expose ourselves to it, we make sure that we put on these thicker masks, the N95 masks, as well as these type of goggles. And all they are is they're nothing special. They're just a standard safety goggle that you can buy at most safety supply stores. But we put those on as well. We got rubber gloves to go over our standard gloves, latex gloves and stuff that we use. We have a trash sack, because when we get done, we throw the rubber gloves, we throw the booties, we throw the gown and everything in this trash sack, and we leave it at the infected person's house, so we don't bring it back to the station to throw away and possibly get secondary infection. So here you see the booties that we can put over the top of our shoes if we need to. And then the gowns, these are just standard gowns that they have at the hospital. They're kind of like the gowns that you see on TV that a lot of people are starting to use as far as protection. And we make sure that we put these all on, and each other, kind of can see how it opens up right here. And you can put it through your hands like this and this, all the way through. And then you have a partner kind of tie it off on the backside for you with that. And then that way, with these gowns, we get the infection on them and not on our regular clothes. So after we're done with all that stuff, when we get back outside, we start peeling layers off. And what we start with is we start with taking off the gown first when we're outside. And then we take off the goggles next, and then we take off the gloves. And then finally, the last thing is, so that you don't touch anything infectious, you pull off the mask, so that none of that stuff goes and gets into your respiratory tract and spreads the infection. So we determined that this is our best way for fighting off the possibility of us as first responders becoming in contact with this infection.
So now you mentioned about the secondary infectious. What are we doing when one of our personnel get in contact with a possible person who is infected? What is the process of transport that person who has contact with a possible infected patient?
Well, what we tell everybody is that limit your exposure. So how they do that is they've been telling everybody, call your doctor first. So hopefully that's the first line of defense. People call their doctor and get quarantined, self-quarantined until they can get the test to determine if they have the infection or not. So if I come in contact with somebody that's infected, as you guys know, that it could be 4 days or more before the signs and symptoms show up with this virus. If I come in contact with somebody that's possibly infected, then we get quarantined ourselves, whether it's at home, because if I came in contact, say today, with somebody, and then I went home tomorrow morning, and I started showing signs and symptoms, well, I'm gonna stay home, I'm gonna call up my department and tell them, and then they're gonna test the people that I've been around that could possibly get exposed to it. As far as it goes, if I know I've gotten in contact with it and I'm not wearing the proper equipment because I wasn't told the right information and I get it, then it comes down to my responsibility to make sure that I self-quarantine myself, whether it be that I stay away from my family for 2 weeks, or whether it be I stay away from my coworkers, etc. for 2 weeks.
When we show up in a house as a team, and then we have to go back to the station, the person who has contact with a possible infected patient, what is the process to bring that person back to the station?
Well, see, that's why we have all this stuff. We keep that stuff there for that reason. But if we're going on a standard medical call and we're not wearing this stuff, and potentially someone in the family has the infection, the process that we go through is when we come back to the station, we should be following standard precautions, which include taking your gloves off, sanitizing your hands with hand sanitizer and stuff. And if you feel like you're exposed to something, so someone coughs on you or something like that, you should probably take and switch to a secondary pair of clothes and wash the clothes that you have and not take them home with you.
Is there any other way of transport them, or you just as soon as we go back to the station, we clean everything on our rigs? And
we decon everything that we have as far as our equipment that we used on the call, with the cleaner that we have right here. We use this stuff to decon all the equipment that we used on the call, decon all our kits and jump kits and stuff like that.
including radios, pen or pencils.
Anything that was in contact in that general area is deconned with this stuff right here.
Okay.
And then hopefully the people that came in contact with it take their gloves off before they get in the cab. But if they don't, we also have this to decon the whole entire cab when we get back to the station.
Great. Thank you.